COVID-19.
Hello, my name is Teresa Sorbe. I'm a professor of sociology at the Autonomous University of Barcelona, and I'm sitting at the university office in Barcelona, and I have a ponytail with my brown hair, and I'm wearing a plaid shirt. As the editor of the International Journal of Romani Studies, it is my pleasure to welcome you all to our first webinar. We are celebrating this month our second anniversary with 4 full issues already published and the 5th one coming next week, with outstanding scientific works with relevant and important information about the lives and prospects of the Roma communities all around the globe. The presentations you will listen today are examples of it. HGRS is published by Hypatia Press, which is a non-profit publisher focused on the dissemination of scientific journals. Some people from Hypatia Press, but also from the Journal Citations Report, encouraged some of us, a group of highly dedicated Roma and non-Roma scholars, to initiate this project, which is now a reality, a platform to publish cutting-edge and innovative research in the field of Romani studies. We invite you all to visit our website. And now I'm going to give the floor to our assistant editor, Rosa Maria Kostic Cisneros, which works at Coventry University.
Hello, everyone. Good afternoon. Thank you for joining us this Thursday afternoon. Yes, my name is Rosa Maria. I am a Roma woman. I'm wearing black glasses today. I have medium length black hair, and I'm wearing a blazer that's black and white, and I'm sitting in front of a burgundy wall in a white chair. Thank you for joining us. We are incredibly excited to have you be part of our very first webinar. The journal is working to offer spaces to different educators and academics, as well as community members at various points of their career. And we aim to work in an inclusive fashion. And because of that, I'm your moderator today, and we will there are a few points of etiquette for the day. We are inviting people, our panelists, to describe themselves for our visually impaired or blind viewers or listeners. And we would like to say that we have a cap today of attendees. But we also are live streaming on YouTube, and in that space you would be able to find the closed captioning for the event. We also have a team. One of the authors is Spanish, and they will be presenting their work in Spanish, and so I will be translating with them. But their PowerPoint is in English. And so we, as we said, we want to work inclusively in a number of ways, including today. So please bear with us as we offer that translation in that space. We will be using the chat function and the Q&A session yes, we encourage you to use that. If you have a question, we have our presentations. Each one will be limited to 8 to 10 minutes. Then at the very end, we will have space for a discussion. So please do put your comments and questions there, and we will make sure to collect them and to answer them. Hopefully we'll have enough time to answer all of them. We also will be using the chat to share whether links or different resources that the panelists have given to us beforehand, and that includes their longer bios. So I won't be reading a very long bio to offer to save time, but please do check the chat function or the actual website to see who the panelists are in more detail. Without further ado, I would like to start our session. As we said, this is our first webinar. We are looking at Volume 2, Number 2 of the September special issue, which was titled Roma Communities Navigating and Coping with the Current and Future Effects of the COVID-19 Crisis. And as we know, we're still in this crisis. And so the issue was responding to that moment, and our authors were also responding. And we will have 4 different articles that covered health, education, digital literacy, and human rights. And as we said, we also offer a space within the journal for what's called the community spotlight. So we invite people to write something that has been happening kind of at a grassroots ground level. And today we have Jenny Berlin, who would be one of the authors from that spotlight. But it is important for me to note that, yes, hello, Jenny, that there were 4 authors that contributed to that. But today, Jenny will be speaking about her work within that. But I will remind us of that later on, right before her presentation. So thank you, everyone. We also are using social media and Facebook. I will drop that into the chat. But our first speaker is Bernadette Varga, and her paper for the special issue was entitled Access to Healthcare Services for the Roma and Undocumented Migrants in the EU in Light of the COVID-19 Pandemic. It's with great pleasure that I welcome Bernadette Varga, Master of Philosophy. She is a public health expert of Roma ethnicity and advisory group member of the European Centre for Disease Prevention and Control, the ECDC, and a former candidate of the United Nations Human Rights Council's Special Rapporteur on the Right to Health Mandates. So thank you so much, Bernadette, for joining us today. And the digital floor is yours.
Thank you, Rosa. Hello, everyone. Good afternoon. It's very nice to be here. And as Rosa said it, the topic of my paper is the access to healthcare services for the Roma and also the undocumented migrants in the EU in light of the COVID-19 pandemic. But for this webinar, I will focus on the Roma explicitly. So this paper was based, the method was a literature review, and I wanted to collect the data that we have, which is unfortunately for the Roma is not so much. But in general, what we know so far is that there are a lot of Roma, migrant Roma in Western European countries. And even though most of them are European Union citizens, Some of them, they don't even have the European health insurance card or the entitlement to healthcare from their original country. So there are Roma in Western European countries without health coverage at all. And then on the other hand, the basic problem is actually the Roma communities in Eastern and Central European countries, who in most cases live in segregated settlements and areas without proper access to healthcare services or without even proper documentation that they could use when trying to approach healthcare facilities. On the other hand, what we found was that in general, the Roma, they don't have trust in health systems in general, and also in the healthcare staff. They are many times discriminated against, and they face institutional racism. And as you might all know already, the COVID-19 pandemic has increased these problems and issues, and it highlighted even more the institutional racism, because the Roma were scapegoated in many countries. So the results, as I said, partly show that in theory, in the European Union countries, in theory, legal entitlements for the Roma is sufficient, is fine, but in practice, there is a huge barrier in accessing healthcare services as well. And once they even manage to access, for instance, a hospital, then they are discriminated against. So there are different layers in the problem, which should be tackled all on their each individual levels. Another barrier for the Roma populations in general is the lower level of health literacy. So it would be very important to somehow educate the Roma communities, to provide them with health education. And we can see now, especially in the time of a pandemic, how important it is to educate these people and the most vulnerable on what vaccination is, how it works, why we need it, what a pandemic is. So there are a lot of work needed still. And from the conclusions of my paper, we can see that in addition to improving the level of health literacy of Roma communities, we also need to organize informational campaigns and sessions, if possible, within their settlements and areas. We also need the healthcare staff to be trained on diversity, so that we could have healthcare workers in hospitals, in other healthcare facilities, who are aware of the cultural differences that Roma have, and they could also be sensibilized to these differences. On the other hand, it's also very important to train and to have more and more healthcare and social professionals of Roma ethnicity, so that they can also be employed within these institutions, which also contributes to, on the one hand, adapting health systems to diversity, and on the other hand, to decreasing institutional racism. So these are the recommendations, and with consideration with regards to the current pandemic and the vaccination campaigns, we are working now and trying to propose European member states to adopt the following measures in order for their Roma population's vaccination uptake to increase. One is to create call centers that these people can call and get information about the vaccination in their native languages. And the other is to have mobile ambulance cars that would go to these settlements, and they would provide the people there with information, and also they could carry out and facilitate and manage the vaccination locally. and also they could help those people with the registration procedure, because I don't know how it goes in other countries, but in Hungary, for instance, you need to register on a website before getting vaccinated. So these are the outcomes and the results of my paper in a nutshell. And I will be more than happy to answer any questions. Thank you.
Thank you. Thank you very much, Bernadette. It's lovely to hear the kind of global umbrella themes that came out of your paper that I think sits well with some of the themes that came out of the Spanish colleagues' paper. So thank you for that. Moving along, I would like to welcome Dr. Lynn Tammy to the room. Thank you for being part of the webinar. We have your paper, which was titled Across the Great Divide, the Impact of Digital Inequality on Scotland's Gypsy Traveller Children and Young People during the COVID-19 Emergency. It's with great pleasure for me to welcome Lynn Tammy, who's an independent researcher at the University of Dundee, Across the Great Divide, the Impact of Digital Inequalities on Scotland's Gypsy Traveller Children and Young People during the COVID-19 Emergency. Sorry, that was the title. Her bio is she's the founder of iRight, a human rights and equalities consultancy and an independent researcher on human rights and equalities. She has over 30 years of engagement with human rights and equality work at national and international levels, and her qualifications are in community development, social services management, international human rights law, and mediation and conflict resolution. Thank you for being here, and I give you now the space.
Thank you, Rosa. Well, as Rosa said, I'm Lynn Tammy. I'm joining you today from my home office in the northeast, on the northeast coast of Scotland. I guess you could say I'm the elder of the panel. I've got short hair, which is badly in need of a haircut due to lockdown. I'm wearing purple glasses today, a blue and white striped shirt. My background is light green walls and the French doors that lead into my kitchen. Okay, thanks for having me here today. I'm just going to move right in to the subject of my paper, but also give you a bit of an overview of what I see as being the key driver to the situation that the paper examines, and also to give my opinion, my views of potential solutions to the key issues. So basically, my paper is an examination of current national and local government, Scottish national local government awareness of and the responses to the learning, development needs and rights entitlements of Gypsy Traveller children and young people pre and during, and it's ongoing, the COVID-19 pandemic. It gives a bit of a snapshot analysis and with input from community members, given that when it was written, we were in the midst of a lockdown and we've come out of lockdown and back into lockdown. I'm sure this is the same situation for the majority of people here, whichever country you've joined us from. So, you know, snapshot analysis, but what's coming out since the paper was written is there's not been much change in the few months since. I want to start with some figures to help shine a spotlight on the breadth and depth of the digital divide here in Scotland and elsewhere in the UK, particularly within the Gypsy Traveller community. One point about the terminology that I'm using here, Gypsy / Traveller is the officially accepted term for Scotland's nomadic communities. However, it's designed that people can and have the right to self-define within that. So looking at where we started and looking at this breadth and depth, we engaged 70 families, looked at the situation of 70 families in terms of digital access. and found that only 8% of those 70 families had an internet connection or a data package, and just 10% had access to a working device. 10%. Recent government data demonstrates that young Gypsy travellers' educational attainment and positive destinations are amongst the worst in Scotland, so this makes this even more critical. As an example, 23.9% of leavers recorded as white Gypsy traveller left school with no qualifications at the standard Scottish qualifications level 3 or higher, and that is compared to 2.1% for the rest of the children and young people who attend public education in the country. So these are quite damning figures, and figures that government activists and the community itself are aware of, and figures that you know, these figures haven't just suddenly appeared out of the ether. This has been known and common knowledge for decades. What I want to do now is turn to what I see as one of the key drivers of the evident digital inequality, specifically for young Gypsy travellers. And the focus of that for me is discretionary decision-making powers. The powers of support workers, departmental leads, who I describe as the keepers of the resources, if you like. Those people that are engaged to ensure that policies and directives are delivered on and where necessary enforced. It's a defence force, if you like, of what Lipsky describes as street-level bureaucrats, which has great control and considerable impact on institutions, as well as on the lives of clients, participants, members of the community. And they have the authority to engage in practices which can, and often do, contradict the principles of universality and equality of access to public services, support and provision. Because as the real producers of public policy, it is these street-level bureaucrats and not governments or health services or NGO strategists who, through their varying levels of street-level discretion, are the translators of an individual or group's right to access and enjoy public services and support. So there's no argument, and I'm sure most would agree, that discretionary powers are necessary and they're central to keeping the wheels turning. But we should also be aware of the impact that free range or unmonitored discretion and the fact that frontline workers' behaviour will undoubtedly be influenced by mainly media-driven social representations of a group and participants or a community. Thinking about Gypsy travellers, the trigger words and phrases used to represent them: invasion, illegal encampment, they don't pay taxes, they leave rubbish, they're dirty, they're lazy, they're thieves, and so on and so on and so on. This is the narrative that we read almost daily when it's the summer months and members of the community who are nomadic are shifting about the country, and ad infinitum. The challenge, in my opinion, is the assumption that policy that's decided at central level, such as what's agreed and proclaimed at central government level, is then simply implemented in its purest form at the local level. Because in reality, methods of delivery and the quality of service are at the discretion of the person at the front line. The social worker, the community worker, the health worker, the person in the job centre or the benefits office. Time constraints, limited resources, workload, or indeed favouritism or stereotyping based on those negative social representations all impact on the level of access and service that an individual or group receives. And the resultant reality is that often national or central directives are not realised at the local level. And in turn, Gypsy travellers have come to expect and indeed accept that this is and always will be the case for them as a community. What would be the point in presenting for support when the chances of being rejected or ignored are so high, in their view and from their experience? So the solutions, I would put forward that the key solution to changing prejudicial attitudes and these negative social representations and of course the resultant impact lies in locating the issues in the structure of frontline work and identifying conditions that would better support a reconstituted sector dedicated to appropriate services and equality of respect for clients, participants, and so on, and the development of new approaches to support both the frontline workforce, who we must also accept are often under enormous pressure, and the individual or the group accessing support or services. So crucial to this would be robust monitoring and evaluation processes to ensure that that guidance or indeed legislation that has been put together at national or central level is indeed delivered on a basis of equality at the local level, and any negation of obligations to provide all citizens access to what is essentially, in Scotland at least, universal support, any negation of that must be challenged and must be challenged robustly. Because failing this, discretionary decision-making powers underpinned by prejudice and those stereotypes driven by false social representations will continue to be enacted, and the toxic, forever that business as usual worldview of gypsies and travellers will endure. I'll leave it at that, but I'm happy to take questions at the end of the session. Thank you.
Thank you. Thank you very much. Thank you. As I'm reminding everyone, we will take questions at the end when we have a discussion amongst the panelists and the participants and attendees. So thank you. Thank you for that. And now we're going to switch gears a little bit. We're going to have our group from Spain, which has several authors, and this presentation will be in Spanish. I will be translating, so every couple of minutes we will have a pause and I will come in to translate. It is important to note the PowerPoint is in English, so you can also follow the paper in that way. So yes, may I invite my Spanish colleagues to open their cameras, and I will present you. Yes, we have Javier. Yes, if you abrir las cámaras, por favor. Vamos a empezar con vuestra intervención. Como hemos dicho, se hace la intervención en español cada 2 minutos. Yo intentaré hacer una traducción. Diciendo eso, voy a dejar mi cámara abierta, aunque no forme parte del equipo. Ahora soy parte del equipo. Sí, so the title of their paper is COVID-19 Crisis, Impact on Households of the Roma Community. And the authors are Javier Arza Porras, Diana Gil González, Luis Catalá Oltra, Francisco Frances García, María Eugenia González, María Félix Rodríguez Camacho, María José Sánchez Ramón, Belén Sanz Barbero, Carmen Vives Cases, Daniela Parra Casado. So we have, for those of our attendees that are outside of Spain, in Spain we have several, we use the first and the second last name. So this was why the names are a bit longer. And yes, we have a short intro to each of our panelists here. Maria Eugenia González Angulo is a social worker and social consultant for more than 25 years at the Autonomous Federation of Gypsy Associations and a specialist in gender approaches. Maria Felix Rodriguez Camacho is an occupational therapist, has a master in public health, head of the health area of the Autonomous Federation of Gypsy Associations, and a member of the Equisastipen network. Maria José Sánchez Ramón has graduated in sociology and a master in human resources. She is currently a doctoral student in the Business, Economics and Society program at the University of Alicante and is part of the teaching and research staff of sociology of the same university. And we have Javier Arza, who is the doctor from the Public University of Navarra. He is a professor and researcher in the Department of Sociology and Social Work of the same university. In teaching and research field, he has specialized in social and healthcare and in social incorporation policies. Welcome. Thank you. Muchas gracias por estar con nosotros esta tarde. Sí, como he dicho, vamos a poner los bios más largos en el chat, así no se pierde nada. ¿Vale? Así que os paso el espacio.
Pues muchísimas gracias. Buenas tardes. Perdón. Quiero dar las gracias a International Journal of Roma Studies, a Fernando, por habernos invitado como equipo a presentar el informe de la encuesta de impacto de COVID-19 para la población gitana que se realizó en el 2020. Nosotros hemos venido 4 porque creo que era muy importante presentar, es que se acopla, pero lo solucionamos. Nosotros queríamos presentar el informe los 4 porque queríamos mostrar el equipo multidisciplinar que a veces es necesario para realizar un estudio como el que hemos hecho. Un estudio que se ha hecho en muy poco tiempo, en muy poco espacio y de una forma tremendamente rigurosa y en nuestra opinión excelente. Este informe surge el 14 de marzo, se declara el estado de alarma por la crisis de la COVID-19. Toda España se confina y toda la población lo hace. Y queremos destacar que la comunidad gitana especialmente, que en algunos casos salieron al principio en medios de comunicación que no se había comportado correctamente o que había habido algún problema con ellos y bueno, se veía algún efecto del antigitanismo en medios de comunicación. Hay que decir que desde nuestra perspectiva, sí.
So yes, I will just translate that there are 4 of them today presenting because they want to honor the multidisciplinarity ethos of the project. They were responding, so several of the authors work in various capacities, and they were responding to the state of emergency that was declared in Spain on the 14th of March of last year. And what they saw was that there was a lot of tensions and as was said, some cases that they were getting from the families, some cases of anti-gypsyism that they were seeing was emerging.
La población y la comunidad gitana y la población y las familias que conocemos y aquí en lo que se inició en Alicante se comportaron y lo que conocemos en otras partes de España se comportaron de forma cívica y excelente y todas las familias se quedaron confinadas. Y esto es muy importante porque la Federación de Asociaciones Gitanas de la Comunidad Valenciana, que es donde estamos hablando en estos momentos, desde el inicio del confinamiento encuentra que el grave impacto que la pandemia está teniendo en las familias. La pandemia desde la primera semana empieza a afectar a las familias con las que estamos trabajando de una manera muy grande. Estas familias además ya sobrevenían de una situación previa crisis económica del 2008 y se iban recuperando poco a poco. Pero con el confinamiento se ve perfectamente la imposibilidad de asumir sin trabajar durante más de una semana o 2 semanas, con lo cual el problema empieza desde el primer momento. Se considera entonces imprescindible, lo hablamos el equipo, la recogida de datos de forma telefónica para mostrar la realidad que estaban sufriendo las familias y realizar el estudio con los mejores investigadores para que el informe tuviera la máxima rigurosidad. Gracias a las redes y a los contactos, perdón.
No pasa nada. Yes, so as you can see, on March 14th, there was a state of emergency that declared the lockdown. The team decided they were detecting that the impact that the pandemic was having, particularly the economic, referencing the economic crisis, and they felt it was essential to collect data by telephone, even though they were collecting data by telephone. They still wanted to ensure that they had academics and people involved in collecting that data of the highest level to ensure that to really understand the impact that the pandemic was having on the families. Por favor.
Por las relaciones que ya teníamos, compañeros, amigos, con investigadores tanto de la Universidad de Alicante como de la Universidad Pública de Navarra y junto con la red de salud, que es las asociaciones de salud que conforman la red Equisastipen a nivel nacional, nos permite realizar una investigación y extenderlo en todo el territorio español. A través de las asociaciones con las que nosotros tenemos red y contacto y de las personas que trabajan en ella, de una forma, por unanimidad, se decidió que adelante, que se podía hacer. Y entonces se inicia lo que es la recogida de datos. Lo que queremos dejar claro desde nuestra perspectiva como entidades gitanas es que desde el asociacionismo gitano se puede se lidera y se puede liderar la investigación social. Si quieres traducir, sí.
She said one of the key points of their work and that she would like to highlight today is that the network is important, but also that from the Roma Gypsy associations that things can be led from those spaces, that they can be instigated and started and led by the community. And that was very important. She also explained that the university researchers, as well as the network that's referenced here, Equisastipen network, was critical in supporting the data collection process. Yes, adelante.
Liderar la investigación social con esa máxima rigurosidad, pero además teniendo en cuenta que sin recursos económicos previos. Este informe se ha hecho completamente de la buena voluntad de todas las personas que trabajan y profesionales, gitanos y gitanas y no gitanos, de las asociaciones gitanas, del asociacionismo y movimiento gitano, y además de los compañeros investigadores de primer nivel de las universidades, tanto de Alicante, de Navarra, y con una gran capacidad para acceder a una muestra relevante, porque gracias a ese contacto y esa red y de las familias hemos podido acceder de una manera muy rápida a una población muy numerosa. Y que desde la propia comunidad gitana buscamos esa excelencia. Es muy importante para nosotros desde el asociacionismo gitano que a nivel académico se comprenda que con los gitanos, con los profesionales gitanos, se pueden realizar un trabajo muy adecuado, correcto, excelente de cara a la investigación social.
So just to summarize, it was important to highlight that the volunteers, that the network, that there weren't economic resources that were needed necessarily. There was a reliance on the volunteering and on the people, families, community members that were responding to the work and to the situation, and they were able to respond quickly. And this is quite important, because from the university perspective, it was that you can work with Roma and ensure that that work can be excellent, and working alongside and working with volunteers. And so relying on this network is a key finding and really important to the work being presented here.
Y esto es posible, entre otras cosas, porque las asociaciones tienen un trabajo previo con las familias. La experiencia en investigaciones que anteriormente ya hemos realizado, la existencia de profesionales gitanos y gitanas y la creación y participación en redes en todo el territorio nacional. Esto han permitido la realización de este informe. Desde la comunidad gitana, con profesionales gitanos, y dando como resultado un informe que pone de manifiesto la capacidad para la investigación social de forma excelente en tiempo y forma del asociacionismo gitano. Muchísimas gracias, Rosa, por la traducción, y le paso la palabra a Marifé. Gracias.
So we now go to Marifé. I am aware of time, veo, tenemos que cuidar el tiempo, pero sí, podemos seguir. Marifé, no te veo.
Hola, buenas.
Hello, thank you. Yes, I am translating. I'm just aware of the chat. I am translating. The slides are in English as well, so please do reference those. I'm trying to summarize quite quickly. Yes, so please, Marifé, adelante, Marifé.
Bueno, voy a seguir con lo que ha comentado María Eugenia, y uno de los puntos clave que ha tenido este estudio es la sinergia que ha surgido y se ha generado entre la academia y el asociacionismo gitano. ¿Sigo, Rosa, o traduce?
Sí, sigue.
Hemos querido desde las asociaciones poder transmitir unos criterios y un lenguaje que sea también académico, porque creemos que nuestra labor es transmitir lo que está pasando en la sociedad, en las sociedades con las que trabajamos, pero de una manera en la que tanto una persona en la academia lo pueda entender, como cuando nosotros presentamos las solicitudes de por qué es así, tener también, digamos, legitimidad a la hora de hablar de lo que está ocurriendo. Y eso era lo que buscábamos con el estudio.
Okay, she was just highlighting that the relationship between the academy and the associations was key, and that there was a real camaraderie, or to use their word in the slide, a synergy between the different actors and experts involved in the study.
La parte cualitativa de este estudio ha surgido justamente de ahí, de los encuestadores y encuestadoras que ha tenido la parte asociativa, en la que también ha sido formada cada equipo para poder hacer la encuesta de manera unificada y con una terminología en el lenguaje pues que fuera única, o sea, uniforme. Nos encanta poder haber podido tener la experiencia de conocer también otras situaciones que estaban viviendo nuestros compañeros en otras autonomías, y la red de Xastipen, que es una red de asociaciones gitanas que trabaja por la salud del pueblo gitano, que haya podido estar como conexión de todos nosotros, ha sido esencial.
So as you can see that there in the visual that we have here, there's a map of Spain, and that she was referencing the network that the whole network has and that works for the health, and also that there were a variety of individuals that were parts, so with different capacities that were part of the study. Yes.
Y en la imagen pueden ver las asociaciones que forman la red, y con una flecha están señaladas aquellas que han podido participar. El hecho de que no pudieran participar más es porque el estudio se hace durante la fase 0, fase de confinamiento, durante el estado de alarma del año pasado. y entonces no llegamos a que otras asociaciones pudieran participar fuera de la fase 0. Y ya está. Muchísimas gracias.
Gracias, Marife. Thank you. Thank you. And can I invite?
Hola, Rosa María.
Hola.
Hola, yo soy María José y bueno, voy a continuar un poco con la parte metodológica, dar unos pequeños apuntes de la parte metodológica del estudio para situar un poco cómo se ha llevado a cabo. Bueno, pues se trata de un estudio exploratorio a hogares que forman parte de la red de atención de las 5 entidades, asociaciones gitanas que se ha comentado anteriormente. La aplicación de la encuesta se lleva a cabo, como bien ha dicho Marifé, al inicio del estado de alarma durante el confinamiento domiciliario más estricto y se realiza a lo largo de un mes, de abril a mayo del pasado año. Y el ámbito territorial del estudio comprende los diferentes hogares atendidos por estas asociaciones, es decir, comprende el contexto territorial donde se ubican estas entidades gitanas. El muestreo es no probabilístico, basado en la selección de hogares a partir de criterios de diversidad, tanto de la dispersión territorial de los hogares como de los diferentes programas de los que son usuarios estos hogares en las entidades gitanas. Y de la parte esta metodológica, solamente más destacar que los resultados han sido triangulados mediante la introducción en el análisis de comentarios de los equipos de las encuestadoras, que han aportado los equipos de las encuestadoras al análisis, vamos. Si quieres traducir eso y ya digo solamente una cosilla más y ya está.
Vale, perfecto. Yes, so her intervention was focusing on the methodology and the type of the study. She explained that, again, this was a response to the state of alarm that the country was in at the moment, and that there were 5 territorial spaces that were linked to where the network was placed and where they were actually based. The sample was a non-probabilistic type of sampling, so it was based on the selection of households from the criteria of maximizing that diversity. And so now we will move to the innovation of the study and the type of questionnaire and design. Yes, adelante.
Bueno, y nada más incluir un dato que creemos es importante, que es la innovación del estudio. Pese a la rapidez, la innovación del estudio está centrada sobre todo en el diseño y en la aplicación de la herramienta, del cuestionario utilizado. Porque, como bien se ha dicho, la iniciativa surge de FAGA, de la Asociación Gitana de aquí de Alicante, pero una vez que se traslada a la universidad, de manera inmediata se forma un equipo de profesionales que comienzan a trabajar en el diseño de la herramienta. Una vez se tiene, bueno, eso sí, siempre de la mano del conocimiento y de la experiencia comunitario de FAGA, de la Asociación Gitana de aquí de Alicante. Una vez se tiene la herramienta, un borrador, se traslada y se comparte, o sea, se pone en común con las demás asociaciones y se modifica y se adapta. O sea, siempre todo de mano de ellos. Y además el cuestionario es aplicado por agentes de salud de las propias asociaciones gitanas. Lo más significativo del estudio es que en todo momento lo que se ha buscado es que se ha huido de un diseño de investigación, diríamos, clásico, que fuera con una estructura cerrada o estática, para poder abrirlo al manejo y a la modificación por parte de todos los equipos que han participado en el estudio, con el principal objetivo de obtener una herramienta que fuera totalmente o necesariamente operativa y funcional. Y con esto he terminado, intentar no alargarme mucho, y ya le doy el paso a Javier, que es quien de verdad va a dar a comentar sobre la parte más importante del estudio.
So very quickly, the innovation of the tool, of the questionnaire, was the design of the tool and the way that it was continued to be developed throughout the course of the project, that it was always in kind of discussing with the health community members in the association. So there was a real loop of feedback between the designers, the academics, the networks, and the families. So there was a real iterative way of thinking about how that questionnaire should sit. And now she's passing on to Javier, who will have a very brief kind of summary of the final part of the presentation. Yes. So the key findings and conclusions.
Gracias, Rosa María. Intentaré ir rápido. Disculpad por...
No,
por
it's
tiempos.
difícil. It's quite hard,
Sí,
we know, but yes.
Sí, en mi parte quería transmitir los principales resultados, las principales conclusiones que hemos obtenido con este estudio. Quizás el principal resultado ha sido poder constatar el tremendo impacto que la pandemia, que el confinamiento ha tenido en las familias gitanas que hemos podido analizar, y también constatar cómo la intensidad de este impacto tiene que ver principalmente con las sinergias que se han producido entre la COVID-19 y la situación de exclusión previa que estas familias tenían. La situación de desigualdad en todos los ámbitos, incluido el ámbito de la desigualdad. En ese sentido, nuestro estudio ha conectado mucho con un concepto que en este último año ha recobrado actualidad, que es el concepto de sindemia, que viene a reflejar realmente lo que le ha ocurrido a la población gitana durante este espacio de la pandemia del confinamiento.
One of the key findings was not only highlighting the impact that the actual pandemic has had on the families, but also it was an opportunity to see that prior to the pandemic, the inequalities that already existed, and that this study gave light to that in a different way.
Sí, trataré de dar algunas pinceladas sobre los resultados que hemos obtenido en las diferentes dimensiones. Por ejemplo, en el caso de la salud, lo que hemos observado es cómo ha empeorado la autopercepción de salud de las personas, de las familias gitanas que hemos podido analizar, y también cómo se ha incrementado la incidencia de problemáticas psicosociales, como puede ser la ansiedad o la depresión.
The slide says it perfectly. There was a worsening of self-perception of health and a high incidence of anxiety and depression and of problems with as a result of the pandemic. So this became very clear as a result of the questionnaire.
En el caso de la educación, que precisamente es una de las dimensiones que contaban con una mayor desigualdad previa, lo que hemos observado es que la mitad de los hogares señalan que han tenido dificultades para que sus hijos e hijas siguieran los estudios desde casa. También en el ámbito de la actividad laboral hemos observado que 1 de cada 2 hogares han visto perjudicada su actividad laboral durante el confinamiento, debido principalmente a que la mayor parte de sus trabajos eran imposibles de mantener desde el teletrabajo.
So within the education realm, the families found it extremely difficult to teach from home, so homeschooling, home learning, and within the work environment, that the families found that the households, that they were unable to carry out their work via this home office, home way of working. So this
Sí, muy relacionado con la actividad laboral. También la mitad de los hogares señalan que han visto reducidos sus ingresos económicos, unos ingresos económicos que ya estaban muy por debajo de la media de la población española antes de la crisis de la COVID-19. Y también muy relacionado con los ingresos económicos, y quizás este es uno de los datos más dramáticos que hemos podido obtener. Bueno, pues 8 de cada 10 hogares afirman haber tenido dificultades para acceder a la alimentación durante el periodo de confinamiento. Y si esto no fuera poco, a la incidencia de todas estas problemáticas en las principales dimensiones de la vida, las familias gitanas han tenido que sufrir también un empeoramiento de las situaciones de discriminación, ¿no? Algo más de la mitad de las familias que hemos podido analizar manifiestan también que se ha incrementado su percepción de discriminación durante el confinamiento.
Yes, so the final findings were again related to income and economy, that there was a significant reduction in their income. 8 out of the 10 households say that they were difficult even in accessing basic food, and that there were even more problems that were realized because of the perceived discrimination. So more than half consider that it was increased during the state of the alarm.
Cuando hemos comparado nuestros resultados con los resultados de otros estudios similares que se han realizado en España, pero también en otros países centrados en poblaciones en situación de exclusión, hemos observado que los resultados son similares, por lo que se confirma el efecto sindémico que la COVID-19 ha tenido en las poblaciones vulnerables y excluidas.
So they took their data samples and they also compared these to similar studies that were carried out, or to other studies in other realities of the Roma in Gypsies in other countries, and they found that they were very similar. And that comparison highlights a larger problem and a narrative that we've already, that you've mentioned earlier. One of your colleagues mentioned earlier.
Afortunadamente, en todo este contexto tan terrible, hemos podido observar también algunos factores de protección que han permitido sobrevivir a las familias gitanas. Uno de ellos, muy conocido en el caso de las sociedades gitanas, es la cohesión de la familia extensa, y cómo la familia extensa ha podido aportar un mutualismo, una autoayuda, que en este caso también se ha visto complementada por el apoyo que la sociedad civil gitana, tanto laica como religiosa, ha podido aportar a las familias que estaban sufriendo esta situación tan terrible.
So despite all of this very harsh reality, there was, as they've called it, the protective factor, where cohesion and there was a traditional solidarity, and it's labeled here mutualism, that emerged from the families themselves, as well as from civil society and religious communities that were supporting the families.
Finalmente, ya acabando, nuestro equipo mixto, nuestro equipo compuesto por activistas gitanos y también por personas académicas, la alternativa de futuro que observamos, desde luego, es aportar a las políticas, aportar a las intervenciones con la población gitana una perspectiva multidimensional y multisectorial. Consideramos que si la vacuna es una alternativa, o puede ser una alternativa a corto plazo, desde luego para la población gitana la alternativa real es la igualdad y la equidad, porque si no avanzamos en igualdad y equidad, la siguiente pandemia o la siguiente crisis va a volver a pillar al pueblo gitano en situación de especial vulnerabilidad. Y dentro de esta perspectiva multidimensional consideramos que habría que incidir especialmente en algunos ejes. Por un lado, creemos que hay que insistir aún más de lo que se está haciendo, de lo poco que en muchos casos se está haciendo, en la participación de la población gitana y de su sociedad civil. Y por el otro lado, creemos que hay que reforzar en todas las políticas, en todas las estrategias, en todos los planes, dos ejes que creemos que son especialmente importantes, que es el eje de la lucha contra la discriminación, de la lucha contra el antigitanismo, y el eje del reconocimiento del pueblo gitano, de la cultura gitana, de la historia gitana, el reconocimiento tanto social como institucional.
Okay, very briefly, I will summarize that what the mix of activists and academics would like to highlight is that offering to political as well as to several sectors that there's a multi-dimensional, multi-sectorial way of working that has a very positive outcome that has real impact. And by strengthening these various pillars and within civil society, as well as the Roma population, you can fight against the discrimination and social and institutional racism, and that can then have an impact on recognition of the Roma community and Roma population. And thank you.
Muchas gracias y disculpad porque nos hemos extendido en el tiempo, pero es un proyecto con muchas voces y hemos tratado de traer aquí una parte de esas muchas voces que tiene este proyecto.
They've said an apology that they've gone over time, but it was a project with lots of voices that they wanted to include, and so they are grateful to everyone for honoring this way of working and this sharing of their research with the community. So thank you, everyone. Also from me, thank you to all of our panelists, activists, academics that were authors of our last paper. Thank you to the attendees for coming along in the journey and working with us in this way. Because again, we're here to stand side by side and work in this way in solidarity. So yes, so thank you. And now I move to, it's a lovely transition to welcome Jenny Berlin, who is here representing the article on the spotlight. So within the journal, earlier in the intro, I mentioned that the journal likes to have a space where every publication offers what we call spotlight on voices from the community. So things that are happening at a grassroots level. So we have a lovely transition from a paper that was working and using activists and grassroots community members and co-authoring that into now this spotlight issue, which had 4 different organizations, 4 different authors, but Jenny will speak about her role and the work that they've done and within the Traveller Movement, which is an organization based here in the UK, where I am located and Jenny is located. And Dr. Jenny Berlin is the Partnerships and Research Manager at the Traveller Movement, a leading UK national charity working with and for ethnic gypsies, Roma, and travellers. In the article, Dr. Berlin introduces Travellers Movement's new online tutoring project, which was called the Tutors for GRT. And I will post a link into the chats. And so without further ado, thank you, Jenny, for being here and welcome. Thank you.
Thank you so much, Rosa, for inviting me. I should have a slideshow as well. If I don't know who is putting it on, but yeah, I'm describe myself. I'm sitting here in London, in my flat in London, central London. I have a long dark hair, but because of COVID, my light roots are coming out. So yeah, and I'm wearing a black cardigan. So yeah, with my wall behind me is white. So I don't know if the slideshow is coming, or should I share myself?
Oh, if you want, you can share it.
Let's see. I'll try to share it. Yeah, can you see it?
It's coming, I believe. Yes.
Let me go to the slides from beginning. Okay, so hi everyone. So I'm today talking to you about our Tutors for GRT project, which is a partnerships project with King's College London Widening Participation Program. And this project was a reaction to COVID-19, which I'm going to explain a little bit more with the coming slides, how it came to life. First of all, who we are, the Traveller Movement. We are a leading national charity committed to the fulfillment of human rights for ethnic minority, Gypsy, Roma, and Traveller people. We are mainly a campaigning and advocacy charity, and there's our email website if anyone's interested. I'm Dr. Jenny Berlin, and I'm the Partnership Research Manager, as Rosa said. We do advocacy and campaigns, we do policy and research, we do community development, which this project falls under. We do also training and awareness raising, events, and a national. We have an annual national conference, which is probably the go-to event in a Gypsy Roma traveler sector in the UK. And then finally, we have an equality and social justice unit that we help do casework with discrimination cases in the UK, with discrimination public and private services. So that's very quickly that. So this project, so I want to put this in for situation for students of Gypsy Roma traveler students before COVID. It was not great, as Dr. Lynn Tammi also explained. So they have the lowest attainment of all ethnic groups throughout their school years. At early years, only 36% of Gypsy and Roma pupils and 39% of traveler of Irish heritage pupils achieved a good level of development. At Key Stage 4, the disparity is even greater. The attainment 8 score, which is the average point scored for attainment in 8 GCSEs, including English and maths, was only 18.2 points for Gypsy and Roma pupils and 21.9 for traveler of Irish heritage pupils. Compared, the average in the UK was 46.5. So the situation was not great. These figures are up to date, the latest government data made available. And we have a report just came out, Gypsy Roma travelers in secondary education. I think Rosa is gonna put the link in the chat. So tutors for GRT, as I mentioned, it was a reaction to the COVID-19 pandemic and the fact that the schools closed in the UK and families had to start home educating. So from our previous years of previous work in education, we know that some families will be digitally excluded, so they don't necessarily have the required equipment, so laptops, tablets. They don't necessarily have the good enough Wi-Fi broadband connection. And secondly, we know from our work that some parents will have a limited literacy and numeracy skills, or for Roma families, limited English language skills. So they will not be able to homeschool their children. So this is kind of the idea when the schools closed, we were like thinking that this is going to be an issue. And then the overall aim of the whole project is to increase the attainment and reduce the gap between Gypsy, Roma, and traveler students and their peers. So that's kind of in the background of an overall aim. So how it started, so as I mentioned, this is a partnerships project with King's College London Widening Participation Department, and who the department's goal is to working to address barriers of students underrepresented in higher education. So that's kind of the goal for our King's College London partners. So partnership, they were thinking the same thing, and we were thinking the same thing. So we kind of we put a call out on our social media to call out for tutors who would be willing to voluntarily teach traveler Gypsy Roma kids online, provide tutoring for free. And we put the call out, and we were inundated by people contacting us. There was tens and tons of people who wanted to do that. We started doing DBS checks, which is kind of check the background, so there's no criminality or anything there. And then we put a call out on our social media platforms for families who would be interested in getting the tutoring. And we started getting families. We got few at first. They started the program, and then the word spread, and we got more and more. At the beginning, we didn't have any funding for the project, so we were obviously the tutors were volunteers, and then we started fundraising for tablets to give the children because not everyone had it. So at the first stage, the tutoring was happening via WhatsApp calls, it worked, but it wasn't ideal. So then we started fundraising for tablets. We had an Amazon wish list, and I think we got donated at least 20 tablets, which was great. But now the project it's been such a success. So the project is now fully funded by National Lottery COVID-19 Community Fund and the Ministry of Housing, Communities and the local government. So how does it work? So it works that we have identified a professional tutoring platform called Tutor House, who provide fully qualified tutors who are often teachers, so really qualified, and the online tutoring teaching platform. So we did some research. My colleague did some research into it to find the easiest to use platform for people who don't necessarily know how to download apps on their phone or anything like that. And we found Tutor House was the best option. So basically, the families are just sent one link and they click the link and the tutoring platform opens, and it has the video function, so you can see your tutor. It also has like calculators, you can write, you can watch videos. So it's really good. All the tutors are paid per lesson, which is really important for us and our partners. All children get a free tablet from us and individual resources. It's a 1 hour a week lesson and designed for each children's needs and likes. It's usually maths and English, but there's also geography and stuff like that. And the design for children's like is really important. So because then you kind of inspire the kids to learn and keep their interest. So as an example, we had one young traveler boy who wanted to learn how to read better by reading the Tyson Fury's biography. So and he's done great in the project. So this goes to show if you are a little bit flexible and cater their needs, how well it works. Then we get monthly reports of each child's progress, and at the end, obviously, we will be writing a progress report and project report. And because the project is so flexible and it's inclusive, that's why it works. So it was designed from the beginning that it's as inclusive as it can, and it will be flexible because of families might have some other issues to deal with. So and it have worked perfectly. And then who is it for? So it's for children of Gypsy, Roma and traveler ethnicity who are in full or part-time education, or who are temporarily out of school because of COVID-19, but are intended to go back after the schools open again. It's age inclusive. We have school children aged 5 to 18 years old. And an important point that it's not for children who are being taken out of school and home educated, and it's not a replacement for school of anyone. It's just a top up or catch up service. And we are completely fully subscribed, so can't take more references at the moment, unfortunately. Then some demographics. Currently, we have 108 children enrolled. 10 have dropped out because of various reasons. Some because school started again, some think they didn't need it, and so forth. We have 53 Roma students, 34 Irish traveler students, 29 English Gypsy students, and 53 of them are boys and 55 of them are girls. And the age range is 5 to 18 and median age of 9. Then this is how well it's been going. So this is the attendance rate of those children in a project. And as you can see, it has barely dropped under 70% attendance at some point, but it has even hit like 100 in some points. And this is kind of what if you remember one of the first slides to see how badly bad the rates are for traveler children in school generally. This goes to show if there's right support available for children, support that they are entitled to, they will thrive. We kind of think that this project proves this. Then to finish with a couple of case studies, I will read it. You can all read it, but I read it as well. So in case if somebody is visually impaired. So case study 1 is SM is a 12-year-old English Gypsy girl When we first spoke to SM's dad, she was temporarily out of school due to bullying because she lived on a site. Her dad felt the teachers were not taking it seriously and was thinking about taking her out of school permanently, as she had already learned the basics. SM started having weekly tutoring sessions in September 2020. She has only missed one lesson in the 17 weeks of teaching, making her attendance 99.5%. And academically, when she started, she was working slightly behind the expected level of her ski stage. However, this has steadily increased to now exceeding that of expectation. SM is still enrolled in school, a different one to where she was bullied, and is in the top set of maths and English now. SM has reported an increase in confidence while learning. This view is shared by her tutor, who has now been working with her for 6 months. She is eager to learn more complex processes, including using technologies such as using Excel and formatting documents. She's making friends in her new school, something she struggled to do previously. And the tutor and her parents remark on how her confidence in learning and herself has made the process a lot smoother. So you can see how amazing progress. And another case study before I finish. Elsie is a 7-year-old Polish Roma boy. Elsie joined the tutoring program in November. His cousin has been on the program since October and recommended to his parents who were looking for extra learning support after school. Elsie has always been engaged as a learner and has progressed at the expected level for his ski stage. Elsie has dealt with changes to tutors as well as having some connection and technology problems during the last 4 months. However, this has not stopped him engaging. Monthly progress reports show that academically he has been progressing at the expected level of his ski stage, but his effort and commitment to learning have increased from the level of good to outstanding. This reflected in his attendance record of 100%. Even when there are technology issues, he engaged with the tutor over a phone call and still completes the lessons and homework set. Elsie has grown in confidence in the session and recently started vocalizing that he enjoys science, especially animals and the environments. So amazing evidence of how the project works and how all kids can thrive if they get the support they deserve. And then just a few examples of King's College London kind of midterm. They organized this little workshop on top of the lessons they do in the tutoring and ask like what you want to do when you grow up. And as you can see, there's someone wants to be an Royal, I don't know what's the short enough. So it's like an animal welfare charity, and I think there's someone with biology and stuff. So yeah, and thank you very much. I think I stopped sharing, and thanks very much for letting me share about our project. I'm happy to answer any questions.
Thank you very much. So now we will open the discussion. I invite everyone to turn their cameras on, all of our panelists. We have slightly less time than we thought we would to have our discussion. Nevertheless, we will still have a discussion. I'll wait for everyone to turn on their camera. Hello. Welcome. Thank you, everyone. Lovely papers and interventions, some overarching themes here that I've kind of see emerging. I'd like to go back to Bernadette and start there. And first, yes, I'd like to ask you if you think that if you can speak to maybe some recommendations or ways that we could put pressure on member states or on the EU so that they can take some of these recommendations more seriously, particularly you speaking as a health expert. Yes.
Yes, thank you for this question. It is, I think, the most important question in the whole procedure. What I have been doing, and I do actively, and I welcome everyone else to join me in this glory battle, is to advocate, actually. So what we can do is to approach policymakers on the EU level, on our national levels. We can send them these recommendations. We can also refer to the new Roma national integration strategies that was adopted in September. So I think that we have a lot to do, but if we work together, we can also achieve a lot. So I would encourage everyone who would like to contribute to advancing the access to healthcare services for the Roma populations, to contact even on their local levels, the politicians, and to sit together with other NGOs, organizations, experts, to create a little proposal and then go for it, submit it to any levels where you can submit it to.
Fantastic. Thank you for that. Thank you. So real call to arms here, and real, thinking about what can actually be done. So thank you for those recommendations. Yes. There are a few questions in the Q&A section, so I will read those. But I encourage everyone to ask your questions. Hopefully we'll get to all of them. The first one I see was here for some time from Maria Esther Lopez, who is asking in Spanish, so I will read it in Spanish and then translate it. ¿Habéis podido evaluar en los resultados el impacto de las políticas públicas de empleo y salud? Si han llegado, si se han quedado fuera por la precariedad laboral. So the question is, have you been able to evaluate the results and the impact of the work of the políticas públicas the impact of the public policies in the within employment and health? Have they actually had an impact? And if not, if they've stayed outside because of the precarious situation. I'm assuming, is this question for the Spanish colleagues? I'm assuming because it was in Spanish. So yes, I'm getting the nod from Tere. So I don't know if my Spanish colleagues would like to answer that question.
Sí, no hemos podido analizar este tema con mucha profundidad y de hecho tendrá que ser objeto de futuros análisis, pero lo que sí que hemos podido constatar con este estudio es la falta de políticas de empleo previas. Lo que hemos podido constatar es cómo la situación de precariedad tremenda en el empleo con la que ha llegado la población gitana a esta crisis, pues la ha hecho caerse, ¿no? Ha sido como un soplo de viento que se ha llevado por delante a gran parte de la población gitana por esa situación de subempleo, de empleo precario, de empleo de muy pocas personas asalariadas, de personas mayores con unas pensiones muy bajas, que en las condiciones de confinamiento se han demostrado absolutamente insuficientes para poder sobrevivir, ¿no? Y lo que sí hemos constatado también es cómo las diferencias territoriales en cuanto a políticas. Sí que hemos podido ver cómo en las comunidades autónomas que hemos analizado, donde había unas políticas de rentas garantizadas más potentes, han permitido que las familias gitanas pudiesen sobrevivir mucho mejor, y en aquellas comunidades autónomas sin prácticamente políticas de rentas garantizadas, la situación ha sido mucho más dramática.
I will very briefly translate. Javier has said no, they haven't been able to analyze the impact. That's something that remains to be done. They are saying that the precarity of the Roma community prior to the pandemic, well, with the pandemic, has been in a way a windstorm that has just kind of knocked it down completely, and it's been highlighting the the lack of resources, and also the link between the political and territorial aspects, that depending on where you were, that, you know, if there were certain policies in place, then that had a different impact. There were differences, for example, he mentioned pensions and salaries, that this was very much based on that tied to political structures that were in place. But again, that it was it became very relevant to the, and they could see that there was a major kind of precarious situation before, and even more so during the pandemic. So the next question I have is from Ramon Eduardo Lares, who says, my question is for the Spanish group of researchers. How was the approach to the Gypsy community? That is, were the Gypsies reluctant when researchers approached them? I ask this especially about the pandemic, since the previous vulnerability of the community, discrimination and fear of contagious, was added. So was there a fear? Yes. Lo tengo que traducir. La pregunta es para el equipo español, que cómo ha sido trabajar con la comunidad gitana. Pregunta si había como unas barreras que cuando los investigadores iban a conectar o a hablar con las familias, y lo pregunto especialmente en relación a la pandemia, porque encima de eso había la comunidad era súper vulnerable y a lo mejor miedo de contagiarse. Así que, ¿cómo ha sido esa relación y se ha navegado eso con las familias?
Bueno, lo primero, quizás aclarar que ha sido una encuesta telefónica. Entonces, esa problemática de acceder a las viviendas no existía. Ha sido un estudio hecho en fase de confinamiento absoluto, ¿no? Entonces, no se podía hacer encuestas domiciliarias. Aún y todo, también podríamos habernos encontrado con dificultades para que las familias contestasen a la encuesta, ¿no? O para localizar a las familias. Estamos hablando de una población que, desde el punto de vista de la investigación, es una población difícil de contactar, de localizar, de contactar. Entonces, la clave en este caso ha sido la alianza entre la universidad y el asociacionismo gitano. Cuando el asociacionismo gitano y la universidad se alían, se pueden llegar a resultados que serían imposibles únicamente desde la universidad, ¿no? Entonces, las asociaciones gitanas han permitido localizar a las familias. Las personas encuestadoras, como hemos comentado, han sido en todos los casos personas de las asociaciones. En la mayor parte de los casos han sido personas gitanas las que han hecho las encuestas, y bueno, pues eso ha sido la clave y no ha habido ningún problema. Ha funcionado todo muy bien.
Very briefly, he wanted to highlight that, again, this was done all by telephone, that the data collection process was done by telephone. Indeed, he acknowledges that there might have been a difficulty for the families answering the questionnaire, but that because of the alliance with the Roma associations, that alliance between the associations and the university and the academics allowed for there to be a real impact and a direct connection that that had a real impact, and that is the points of the work, that innovation and that support between both camps allowed there to be a real access to the families.
Nada, simplemente apuntar lo que ha comentado Javier, que aparte de esa sinergia que ha habido entre la universidad y las asociaciones, también tenemos que tener en cuenta de que estaban totalmente confinados. Entonces, esas familias, en la mayoría eran mujeres las que atendían a las llamadas, las encuestadoras eran mujeres y tenían ganas de hablar. O sea, el confinamiento estricto también era un poco que tenían ganas de decir todo lo que les pasaba. Entonces eso también ha ayudado muchísimo.
So the highlighting that the women were key people involved in the data collection process as well, not only answering the questionnaires but collecting that information, and that the women were very keen to share their stories and the things that were happening to them, and so the confinement allowed for that to happen. I will move on. I'm sorry, Marife, I just want to try and get through all of the questions. So yes, we have one. Does another panel member want to? Sorry, I see, Bernadette, you were. No, okay. Does anyone else want to respond to anything that they've heard so far? No, okay. We have a question from Professor Tapan Mohanty. If we believe that globalization has faced a challenge due to COVID-19, a sort of deglobalization, then how do you perceive the protection of human rights of Roma people? So this is for everyone. La pregunta es si pensamos que la globalización de face the challenge due to COVID, que hemos enfrentado unas dificultades por la globalización de COVID-19 y de cierta forma una deglobalization, no sé cómo se dice eso, ¿cómo pensamos, percibimos la protección de los derechos humanos de los gitanos? Así que es una pregunta para todos. Lynn, you would like to respond? Yes, first.
If I'm understanding the question properly, so apologies in advance if I'm not understanding it properly. For me, that is a key issue. As people, I mean, an example of this is the UK having removed Brexit, having removed itself from the protections that we have in terms of human rights conventions and directives from Europe, although we still have our own Human Rights Act that removes the foot to change that. And that is something that needs to be resisted strongly. And we need to be engaging those activists who are looking at human rights as a universal directive within a member state and ensure that gypsies, Romas and travellers are part of that narrative. Because if we don't start moving now, certainly here in the UK, and include Scotland as well, in that we have a devolved government, but we're still part of the UK. If the communities do not make those connections now, there is a real danger that we will be left by the wayside. It's almost like a scramble for who has the loudest voice. We as communities have very few celebrity supporters who stand up for our rights. So we need to, even more so now in the UK, we need to come together and start to stand up for our rights. That is also something across Europe and elsewhere, because although we speak about United Nations conventions and charters being universal, that is not the reality at the local level. So we need a strong movement, and we need that strong movement now.
Thank you for that. Thank you for that. Would anyone else like to respond? Yes, Bernadette.
Yeah, thank you. I completely agree with what I've heard, and I would just like to add in addition to that, that let's not forget about the fundamental human rights. So if we talk about the health, and the right to health is a fundamental right, human rights. So yes, we need actually to together, and we need to make sure that we can protect the human rights of the Roma, let it be the right to housing or education or any other field. Thank you.
Yes, and I'd like to invite Marife, if you want to we're about soon going to close the session, but I know that Marife had something she wanted to say to answer the previous question. Marife, no sé si quieres ahora decir y compartir lo que querías decir antes. Tenemos un minutito y te quería dar el espacio. Sí.
No, no te preocupes, lo he puesto por el chat, simplemente.
No. Well, on that, we're already a few minutes past, and sadly I must end our session, but I do want to say thank you to all of our speakers. I think there were several themes that have emerged around narratives, alliances, solidarity, working with the communities, protecting human rights, ensuring that the communities, civil society are also part of the academic studies, that health is linked to education, and that there's a real interconnectedness between the several topics. And we've seen several examples of when there's a flexibility, when there is a way of working that includes a multidisciplinary way of working, that then there's real impact despite the precarity that the communities find themselves in. So it's been really, thank you everyone for carrying out this really important research. We're still in a pandemic, so this is still incredibly relevant, but it's not only for COVID-19, it's about ways of working. And as Lynn said, that, there's a real movement that is needed and that we can stand by. And as Bernadette said, really there are practical things we can all do. So thank you, everyone. Thank you to all of our attendees. I'm really sorry we're over time, but yes, thank you. Please do get in touch if you'd like to get in touch with the authors. So thank you again. Gracias a todos. Muchas gracias.
Thank you.
Gracias.